our pets are living 2/3 of their normal lifespan. I'm not just trying to make your dog live to 15. I want it to be healthy through those 15 years. It doesn't do us any good if I make your dog live to 12 and it's miserable and it can't breathe and it's scratching its face off. You know what I'm saying?
Hey, Drew here. Before we get started, I want to tell you about our sponsors for today's show. First, I want to tell you about an amazing way to support your dog's health. Jope's Hip and Joint Dog Chews. Their unique formula combines therapeutic dose of UC2 collagen and a high dose of omega-3 and curcumin from turmeric. Jope uses the most science-backed ingredients for mobility and long-term joint health, including UC2 collagen, which has been shown to outperform glucosamine in several studies. Founded by veterinarians, Jope offers a product you can trust, made by experts passionate about dog health, here in the USA. I subscribe to Jope's Hip and Joint Dog Chews for my own dog. Ozzy loves the taste, and I feel great knowing I'm giving him the support he needs to thrive. By subscribing, I never need to worry about forgetting to give him the care he needs. It's never been easier to give your dog the best supplementation for healthy joints. This combination of high-quality ingredients, expert formulation, and manufacturing integrity ensures that Jope supplements help put the spring back in your pup's step. Go to petjope.com, petjope.com, and enter promo code LOVEDOG, all one word, at checkout. You'll get 15% off your first order. Also, Colorado Citizens for Canine Welfare. Imagine a world where every dog knows the warmth of a loving home. A world where dogs are not trapped in small wired crates and dealing with extreme weather conditions and neglected by humans on a daily basis to turn a profit. Picture a place where mother and father dogs live free without the cycle of constant breeding and where puppies aren't commodities for profit. This is the world without cruel puppy mills. Let me introduce you to Colorado Citizens for Canine Welfare. 3CW is on a mission. A 501c3 nonprofit organization working tirelessly every day to turn this dream into reality. Join the fight against inhumane treatment of thousands of dogs trapped in commercial breeding facilities. 3CW aims to educate, enlighten, and to make a difference, to be the voice for the voiceless. You too can be a part of this necessary change. 3CW is dedicated to all dogs. They help guide puppy buyers to adopters towards responsible choices, adopting from licensed shelters, rescues, and ethical breeders. As dog lovers, we have to advocate for local and national animal welfare laws and be the change. Join us in creating a future where every dog has a chance to a warm and loving home. To learn how to find licensed, inspected shelters and rescues, visit the Find Dogs page at caninewelfare.org to learn how you can make a difference. Colorado Citizens for Canine Welfare, where compassion meets action. Now, let's get on with the show.
In humans, ginger or habanero pepper is hot. Watermelon, cucumber, cold. There are foods that create heat in your body, there are foods that are neutral, and there are foods that are cooling. And so what we talk about a lot is in conditions that are hot, the hot, itchy, red skin, the hot, painful leg from arthritis or back from arthritis, the cancers. Many of these diets need to be more neutral or cooling. And so the three meats we stay away from on the hot side are...
Hey, Drew.
Hey, Mark. Here we go again.
Here we go again. Each week that goes, or each episode that goes by, I should say, we're picking up some new listeners, which is a good thing.
Glad you're
and
here.
We feel great about that. So for anybody who's new listening to the show for the first time, just want to tell you this is a podcast about dogs, but it's really a podcast about you and your dogs. And what we're doing here is trying to help you make the best choices for your dog so that you can give him or her the very best life possible, the best friendship possible, more than what you might have ever imagined possible. So that's what we're all about here, and that's what we're trying to do. And this interview, Drew, that we have coming up right now with Dr. Randy Aronson, he's a holistic integrative vet, been practicing for about 43 years. He's over in Tucson, Arizona. I love all of our shows, but as I was going through this show, I really, really loved the conversation. It went deeper than I had remembered. We cover a lot of territory. There's a lot about food and feeding your dog in this episode rather.
So if our shows were children, this is your favorite kid?
I think this could be one of my favorite shows so far.
Well, I love it. And Mark, you're telling our listeners about how we're trying to help them do better for their dogs. And really that is the point of this entire interview and this idea of holistic or integrative medicine, where we're taking a macro lens, not just looking at each little thing independently, but how does the whole system work? How does it affect our relationship and our dog's thriving? So I love that.
Yeah, it's like your dog is sick. He has a problem with his kidneys, or he has a urinary tract infection, or a problem with his heart. Well, why? What caused it? How did he get that?
Should we put a Band-Aid on that, or should we get to the heart of the issue?
Yeah, that's what this is. So I feel really good about this. This is part one of a two-part series. We'll release the next one in a couple of weeks, and we're going to get really deep in that issue. I keep saying issue, but I mean episode. That's because I'm from the magazine world.
It's an audio magazine. I like it.
Yeah, it's an audio magazine. There you go. Yeah. So how about if we just get going with the show and get into it?
Yeah, listeners, you're going to love this one. We get into everything from diet, allergies. We do a case study, which if you haven't heard many case studies, it's really practical information where you get to see how did they treat that dog. So stay tuned, listen through to the end. You've got a lot to learn.
Hey, Randy. Hey, Drew.
Hey, Mark.
Hey, Mark. Nice to be here. Nice to be here with Randy Aronson. Welcome to Love
Thank you so much. It's great to be here with you guys.
I can say with all honesty that this is an interview that's probably one of the ones I've been most excited about because I love the topic. I say we just kind of get right into it. And what I'd like to do, which is what I usually like to do for our listeners, is I always like to define what something is. And in this case, I think what I'd like to do is demystify, to the extent that we can, this whole idea of integrative, functional, holistic medicine and how it's different, or should we say stands apart from traditional Western medicine, and where they come together and where they work well together. And I'm just going to give you the floor, Randy, and ask you to go for it.
Thanks, Mark. First of all, I want to thank both of you because of the amazing job that Love Dog is doing for all of our pet parents. It's phenomenal. So I appreciate you guys, and I hope that our listeners totally appreciate what you're doing.
Thank you.
So let me talk a little bit about integrative medicine. So integrative veterinary medicine, also known as holistic medicine, complementary medicine, it's an approach to animal healthcare that combines the absolute best of Western medicine. And we're talking about x-rays, blood work, EKGs, all the diagnostics, all the examinations that we do in Western medicine. And it looks at how to treat the whole animal. It's a complementary therapy to look at underlying imbalances. Western medicine does a beautiful job of diagnosing, treating emergencies. Integrative medicine takes it one step farther and looks at the whole animal. And how do we look at imbalances? And we'll talk a little bit about, when I talk about my path, how that happens, because it's a very interesting, it was many, many years ago when I started this, it was new to me. And so it's a definite different pathway for all of us. And it will be very interesting as we go on.
Well, it's so important, it felt like 10, 15 years ago, I would meet clients and I would have to talk to them about where they were going for their veterinary care. And occasionally, working in Seattle, we'd have a lot of clients that were going to see holistic, and people would talk like under their breath, like, oh, we go to this holistic, like they're about to tell me about voodoo and, saging pets or something. But now it's coming into the common practice and people are really understanding, oh, there are some benefits we can be getting from all different places and we don't just have to follow this traditional model. And I'm sure you're running into that where you're seeing pets who've tried one or two or three or maybe more modalities, and you're like, wait, there is another option here.
Absolutely. One of the most interesting things, Drew, when I was doing national radio was that people would tell me, I'm giving my dog curcumin or turmeric. I'm giving my dog methylcobalamin or B12, but I'm not going to tell my veterinarian because he or she doesn't know anything about it, and I don't want them to judge me.
Right.
And nowadays they can research a lot of this on I call it Dr. Google.
Yeah, exactly.
And they come to me with what we call N of 1 cases, meaning one person did one thing and this is what I'm going to do. And we dispel a lot of that to get to N of 100 so that we have the history behind us. But yeah, it's a very good point, Drew. Very good point.
That's great.
So what you're saying there is that a traditional veterinarian, in a way, shames you.
No, not necessarily. Right.
That's what it sounds like.
Not necessarily. And it's not meant on purpose. I will tell you that there are, just like everything else, just like what Drew does, Mark, what you do, there are people who look at certain things in what you're doing and are very comfortable with that. And there are people who like to expand their horizons and look maybe outside the box. And if Drew did one training technique every time he was treating an animal, he knows that wouldn't work. And it's the same thing for us. So the point is that a lot of times veterinarians will call me about certain modalities and I can explain that to them. And I love that. I love that they're open to hear. But really the pet parents, what we're doing today is what I love the most, because they're receptive and they want to learn and they want to know the right things, but they don't know how to do it. It's just kind of like there's not one place you can go to find that answer.
Right. Talk a little bit about, in general, how what you do ties into pet wellness overall. And I've talked about
Sure.
wellness before on the show, and I've talked about it. I think of it as a lifestyle. So pet wellness, I see a whole lifestyle going on there, and then add to it the idea of
Sure.
longevity.
So the evolution of what I do has now gotten to the point where I have very, very strong experiential feelings and evidence in my own practice, looking at hundreds and hundreds of dogs and cats to understand what promotes wellness and what helps with longevity. And that's where the thought came to me to start speaking on this. And this is kind of how we all hooked up. I'm going out there right now and doing keynotes and webinars and lectures on pet wellness and longevity, because there are some really good, hard and fast numbers now to prove a lot of the things that we've been talking about really are working. I had mentioned to you earlier, Mark, the Dog Aging Project that is looking at a ton of things. You know about the program in Colorado on golden retrievers through Mark Morris Foundation. We are now getting really good information. We're getting statistics. We're getting science instead of just the evidential stuff that I get to see. And I'm lucky because I've been doing this for 43 years. So in that time period, I have some great experience on what does work, what doesn't work, what might be thought of. But the idea to me is the thing that scares me the most, the thing I lead off my talks with is our pets are living 2/3 of their normal lifespan.
Yeah.
They are not living their normal lifespan.
Yeah.
And we're going to talk about a lot of things in this talk. When we all discuss this, you'll understand why.
Yeah. That's huge. I mean,
It makes me want to ask why, but should we hold off on that for just a moment?
I think it's going to become more and more evident. And we'll talk about a lot of things to feed that. And if we don't get to what you feel we needed to discuss, Mark, by all means, start the conversation. But I think it'll be evident to people where this is coming from.
Okay, great.
Randy, you just said you've been practicing for over 40 years. And do you feel like there's been some intuition or something that's just been known and it feels like maybe science with our new tools and research is catching up to some of those things that maybe we intuitively know when we look at the animals in front of us?
Yes, I do, Drew. And I also think that by looking at outside the box and looking at the paradigm of Chinese medicine, let's say, that looks at the whole person, the whole animal, we're being able to combine these things to help us in that endeavor. But I think that, There's a great friend of mine here in Tucson. Her name is Linda Johns, and she's an animal communicator. And I could tell you some unbelievable stories about that woman and her ability. But one of the things she's told me for years is I actually have that ability going into a room. Intuitively, a lot of times I have a feeling for what is or what isn't and can work on that. But I think that intuition that Drew is mentioning really is now becoming borne out with science. I really think we're getting to a point now that we're starting to understand why acupuncture points work or other types of modalities.
Yeah. Turns out the whole body is connected,
Correct.
right?
Absolutely. Absolutely.
Who knew? We needed science to
Right.
tell us this.
Well, this is a conversation that's going on in a huge way in
Right.
the human realm. I mean, the doctor that I know about, and I think, Drew, you've mentioned his name too, is
Yeah.
Peter Attia. He talks a lot. I mean, that's what he does,
Sure.
is longevity. And there are many, many people that are on that track right now. So I guess it's interesting, and it's also just a very good thing that the same thing is happening
Right.
in the human realm. We're looking at these paths that we can take to increase longevity, because we'll get to why dogs are living 2/3 of their lives.
Mark's
but
hungry for this,
that-
Drew.
Yeah, I'm
yeah.
obsessed now with why.
Let me throw out
yeah.
one thing to you, though, Mark, that is really important. There's a gentleman in Tucson by the name of Dr. Andrew Weil. He's written 8 national
Right.
bestsellers. This is a man who started out looking at integrative medicine in humans. And honestly, when he started out doing this, he was a charlatan. People, they didn't understand. They couldn't believe it. They couldn't even think that he was talking about, let's possibly look at the whole person. Let's add herbal therapy to what we're doing. And he started the integrative medicine department here at the University of Arizona. He is really the nidus for what started me in that, because it was such a relief to hear somebody who said, we need to do something to get to wellness. And as we're talking, longevity.
We've talked about this. The most important thing in any modality is the outcome.
Right.
Right? That's what we care about. What's the result of what's
Right.
going to happen here? And I'm not getting the result that I want from Western medicine, let's say, so I'm going to try, the holistic approach. Contrarily, I'm not getting the result that I want from the holistic approach. Maybe I just better get myself over to the regular doctor, right? So, but what are your thoughts about that, about expected outcomes, and how can we manage expectations?
Well, one of the things that I tell many of my integrative rehabilitation clients that I see is that a lot of what we talk about and we're going to be talking about aren't what we call silver bullets. It's not giving a shot of steroids and the dog feels amazing and we're done. Because we all know that steroid's going to wear off and then cause adrenal problems or muscle problems or whatever else is involved. Sure. So the idea is that we're looking at, you used the word earlier, foundational medicine. That's really the ticket. We want to get to the foundation of what we can do for our dogs and cats and allow that to work. And I don't look at it Western and integrative separately, because I do them both all the time. Because I do integrative medicine, you don't, excuse my French, throw the baby out with the bathwater. I use Western medicine all the time. And I'll give you a great example. It used to be that I would get a phone call, my dog needs to come in for acupuncture. Okay, that's great. What's wrong with your dog? I don't know. What kind of workup have you done? None. And so at that point, I try to explain to them the idea of integrative medicine.
That was me.
Was that you?
Was me that
Okay.
He got a referral from Dr. Google.
Exactly. So, there's lots of reasons that I will do acupuncture, but I also want to know what the diagnosis is, what are we looking at with Western medicine, and then use the integrative medicine to help, if that makes sense.
It does. And one word that I haven't heard you mention is cause. Is this a cause? When you say foundation, is that another word for what's the cause of the problem versus just treating the symptom? Is that part of this
actually,
approach?
when I say foundation, what I'm saying is let's start at the very, very bottom or the foundation of what's going on and work up, meaning let's talk about what food the animal's eating, what water the animal's drinking, what kind of treats is the animal getting. what kind of exercise, and many of the things that we're going to talk about in my mnemonic later. But let's talk about all of these things because this is the foundation of health. If we don't talk about all of those things, then we are not doing us any good. And unfortunately, a lot of times in Western medicine, when you have a 15-minute or a 30-minute office call, it's not going to happen. The practitioner doesn't have the time, many times maybe doesn't have the inclination, is going to sit there and put out a fire and do the best they can to make the animal well and be done with it.
Well, and especially in our medical model, and this, Randy, I've worked in a lot of veterinary practices where you're basically getting the time with the client that's allowed based on, the model, which is usually you're going to see a nurse or a technician first. They're going to run those diagnostics, get some baselines, and then you're going in with the information, which might be the purpose of the visit. So, for instance, if I go in asking about a dental, you're probably not going to come and proactively talk to me about osteoarthritis, even though you're looking at the animal in front of you for the first time going, wait, has anybody talked about this for a metric of health? When the whole point of me going in for the dental is really to improve my animal's health. So it's sort of this whole new approach of how do we create health rather than how do we just treat the symptoms of disease?
Yes,
right?
And actually, Drew, that's an amazing example because let's talk about dental disease just in that situation. If that animal is shedding tremendous amounts of bacteria into the bloodstream, into the lymphatics, do you not think that that's going to affect inflammation in that animal's body and cause problems with osteoarthritis that the animal may have?
So it's not either or. This is all interconnected.
That's it. There's where the integrative part comes because it will affect everything down the line. And if you just close your eyes and say, I'm just going to give that dog a dental, we could be missing a ton of things to help that animal.
Okay, so this is a good time for us to take a break and stick around because when we come back, we're going to get into a conversation about some of the advances that have been made in Western medicine over the years that holistic and integrative veterinarians like Dr. Aronson can bring into their practice to make the whole diagnosis and treatment process that much better. I think you'll find it interesting, so don't go anywhere. We'll be right back.
Hey, I hope you're enjoying our episode so far, and I want to thank the fine folks who've been helping bring it to you. Starting with Jope's Hip and Joint Dog Chews. After trying them on Ozzy, my own dog, I really wanted to have Dr. Christine and Dr. Jeremy, the founders of Jope, support our podcast. Their passion ensures that every product Jope offers is not only safe, but third-party tested to guarantee the quality of the active ingredients, providing pet parents like me with trusted solutions for their beloved companions. To try this incredible product, simply go to petjope.com, petjope.com, enter promo code LOVEDOG at checkout to get a discount off your first order. Why did I subscribe? Because you get the best prices. I don't have to worry about exactly when to reorder, and the ingredients have proven their benefits over the long term. Try them today. And also, Colorado Citizens for Canine Welfare. We love dogs, but what if loving our dogs is not enough? To truly love dogs is to hope for all dogs to live without fear and be treated with compassion and dignity. That's why we're teaming up with Colorado Citizens for Canine Welfare, or 3CW, to educate all dog lovers to stand up to puppy mills. Join our efforts to end the inhumane treatment of thousands of dogs who are trapped in commercial breeding facilities. Together, we can impact national animal welfare policies that shape the culture around pet keeping. Don't turn a blind eye to this suffering that is right in front of our eyes every day. To find licensed, inspected shelters and rescuers, go to the Find Dogs page on caninewelfare.org. Together, we can make a difference. Now back to our show.
Talk just a little bit more about the actual science and some of the Western ways that you go about this in terms of radiology and stuff like that. So just people understand how it's all integrated. And
great question.
One.
So the practices in the United States, the veterinary practices in the United States, we now have so many tools available to us in Western medicine that we really didn't have a lot. When I first started out, and this is before the light bulb was invented, we had exams, we had some blood work, we may have had some x-rays, we had to take the film and dip it in its secret sauce to develop it. Now now, Mark, we have CTs, we have MRIs, we have echocardiograms, we have ultrasound, we have endoscopy, we have digital radiography. It's amazing. And I laugh. I hope the MDs that are listening to this don't get upset, but I laugh because some of the MD clients of mine come in and go, "You guys take radiographs? I didn't know that." And I'm thinking to myself, here I am doing an endoscopy on this animal and an ultrasound to follow. And this guy's asking me about taking plain films, So it's kind of funny, but we do have amazing tools available to us. When I started, there weren't any specialties. Now we have neurologists and ophthalmologists. And don't get me wrong, I think the beauty of veterinary medicine is that as a practitioner, you basically govern that case. I don't know if your experience in Western medicine and human medicine has been like mine, but sometimes the head doesn't know what the tail's doing. They don't talk to each other. The radiologist never talks to the internist. The internist never talks to the cardiologist. It's not the case in veterinary medicine. We control this beautifully, and it's a great thing to have that Western medicine mark behind us. But we have amazing abilities. Now we're doing something called HT Vista, where we take a scanner and we can scan a mass on your dog's skin and tell whether it has a high or low benign probability. Cancer is an abnormal growth of normal cells. So that means benign or malignant, it's still that definition. This unit measures the heat signature of that mass without sticking needles in it and causing it to spread or irritate it. You can actually read this and it tells, do we have to go on. We have photomodulation where we have we're going to talk about hotspots later, but this thing, emits a multifocal light that activates a gel that treats hotspots and skin wounds and ulcerations in a fraction of the time. So The Western medicine has gotten great, and it's very exciting to have that piece and then to have the other things that I use.
Well, and how much less intrusive that is on the animal. I've worked a lot in veterinary behavior practices, and we work with a lot of animals with a lot of fear and phobias that didn't get those early positive experiences. So it's anything we can do to make that experience easier on the psyche of the animals is amazing too.
Yeah, even when you mentioned that, it's something that comes to mind real quickly, and that is we even now have liquid cancer tests where we can test blood for bowel lymphoma, for hemangiosarcoma, for many things. If we have an answer, we need an answer, we take a blood test versus, like you said, Drew, an invasion of, biopsies or open abdominal surgery or any of that. We can avoid a lot of that nowadays.
That's incredible.
That is exciting. That is. It's just hugely exciting. Wow. So let's take a trip down memory lane. Randy.
I'm going to get the brag, according to Mark.
You're going to get to brag about how incredibly educated you are and how well you did in school, which was 70 or 80
a long time ago, yes.
Is that right? Yeah. So how did you were traditionally educated, I think University of Pennsylvania. What was the trajectory? What was the path to where you are today?
So I tell the story that I applied to University of Pennsylvania 3 times and finally got in. And when I got there, I thought that I was having the imposter syndrome. You know what that is? When you finally get somewhere and you say, well, I don't know how to do this. Then I realized that most of my classmates had PhDs. They applied 5 times. So I was actually doing well and went through vet school. I ended up graduating top of my class. I got a wonderful honor in the clinics. Got an internship, which is not common for veterinarians. It's a 1-year rotating internship through medicine and surgery. I also got to spend almost a year at the Animal Medical Center in New York City, which was an amazing place. I'm a visual learner, so I could look at a cushingoid dog, Cushing's disease, once and know what it is. But if I read about it 10 times, it's going to take that 10 times to maybe sink in. Yeah. So when you have 60,000 cases a year, like the Animal Medical Center or the University of Pennsylvania veterinary clinics have, you learn. And so it was fabulous. And I came out to Tucson to practice, was disappointed in a couple of the practices I was in, realized I had to do it myself, got established. The practice was doing great. I was really having a ball. But, one day I finally realized, Mark, that all I was doing was putting out fires. All I was doing was taking the ear infection, treating it with antibiotics and steroids, and then it'd come back. Or what urinary tract infection or whatever. And then this guy, Andrew Weil, came along, and I started looking at this and saying, oh my God, I'm not getting to wellness. I'm only putting out fires. So I made a decision to go to Southwest Institute in Albuquerque to learn Chinese herbs so I could add herbs to my Western practice, only to find out that I had to learn Chinese medicine to use those herbs, which then required me to get certified in acupuncture. And then I went on to get a rehabilitation certification. But it's really the idea that I wanted to change from putting out fires every day to wellness and longevity. And that's what integrative medicine has been able to do for me. It's just been able to allow me to go and really develop. And I'll tell you something else. At 71, 43 years into veterinary medicine, I love coming into practice every single day. There are not a lot of veterinarians in their 30s and 40s that can say that. Because every time I look at a new area, like I'm looking at biome, let's say, or I'm looking at something else, then it's a whole new area that I've got to study and learn about, because if I'm going to talk about it and use it, I better know what I'm doing. So
he sounds like me, Drew, when 3 or 4 months ago, I couldn't have even told you how to hit the record button on a podcast.
And now you're an expert podcaster. Look at you.
Now look at you. Yes.
Yeah, now look at me.
Randy, your journey and your story is so incredible, but how does that become more commonplace? Like, to me, you're an outlier, you're an exception, and I'm sure you know more vets like you, but we know how intensive veterinary school is just to even get in, let alone go through it. The debt that piles up, the mental and physical toll it takes on practitioners just to start practicing. How do they then feel inspired to, do as you do and want to do more? Or how does that system change to incorporate, different approaches to wellness into our training of veterinary models?
Well, I mean, Drew, from your words to God's ears, tell you the truth, because the problem is that the exposure to this is minimal to none in a lot of veterinary programs. And that's the biggest thing that I am up against right now and really helping to change. We are looking at right now at the University of Arizona veterinary program, which is a new program, to actually have an integrative track put in. I go and I talk to veterinary clubs across the United States, but there's no formal education of any kind in those programs. And you're right, Drew, they have so much to learn in Western medicine. It almost is overwhelming. And when I get a veterinarian coming to me and go, how do I do what you do? I tell them that it took me going to get certified in acupuncture separately, getting certified in Chinese herbology separately, getting certified in rehabilitation. It was a personal journey, and I had to do each one of those things myself and seek out where was the best place to find out, how am I going to learn this? The biggest problem right now I'm having, you're not going to believe this, but I can't find a protege to pass on what I know. I want a veterinarian who basically has been out there 5 to 10 years and wakes up like I did and say, you know what? It's time to look at wellness and longevity, because I could teach somebody many of the things that I've done, but there's no set program, Drew. There's no clear pathway, and that's really a problem.
Sure. Well, we've got a little surprise for you, Mark. Bring out Randy's new resident veteran. No, I'm just kidding. If only.
If only.
Maybe on Love Dog, we could be the match.
There you go.
We can put that beacon out there for you.
So I want to go back to something. You were talking about putting out fires, before you got into this other way of practicing. Well, actually, I have 2 questions. So is that putting out fires approach part of the problem, one of the reasons why you think dogs are living about 2/3 of their life span?
Yes.
At this point?
Yes. Yeah, because there are 2 words that are really important. One is called nutrigenomics, and the other one is epigenetics. And those words are fancy terms, but epigenetics is the study of how environment and what we do as humans have affected our body and our disease states. Nutrigenomics is the study of how food has affected DNA and telomere length and many of these things. And these are being looked at very, very closely in human medicine, and they are being looked at in veterinary medicine, because this is going to be incredibly important to longevity studies and wellness. And so that's exactly right. I mean, it's a matter of looking at, I hate to say putting out fires because it's working as a regular veterinarian. I mean, that's a lot of what you do is you're trying to make the animal well. And don't get me wrong, my integrative cases come in and there are lots of other things I need to look at, but I do need to address the problem at hand. My dog is scratching to the point where he's tearing his skin. What's going on? I do need to address that, obviously.
Yeah, that's actually a huge issue, which I would love to talk about. And I have a question. It's on a personal note. You chose to go for the acupuncture, then for the Chinese medicine. I mean, this isn't what you had planned to do, and it just seems like you were hit with one after the other, and you surrendered essentially and said, yes, I'm going to do it. And my question is that for the love of animals? Is it for the love of medicine? Is it for the love of just learning? Why did you keep saying yes?
Because I wanted to torture myself and spend a lot of money. No, it was totally for the love of animals. To start with.
Okay.
But I have to tell you, it's now the love of learning and the love of expanding all of my horizons to understand that there may be energy healing involved, that aromatic oils may work. I don't know a lot of these things. I can't tell you that I know everything that's out there. I don't do a lot of homeopathy. I've just never had time to study Dr. Pitcairn, the father of homeopathy. He lives in Sedona, Arizona. He's right up the road from us. But I never had the time to study with him. So, you have to make some understanding that you're not going to have it all. But the love of the animal, the love of making them well and being able to be there for the clients, it's amazing.
It's so cool because, it seems like we've sort of created this model of specialty in all sorts of fields. And when you start talking about integration, you're willing to look outside for solutions and you're less likely to feel stuck and feel hopeless. I'm sure there's so many people who have struggled and they've struggled with their own dogs, whether, like allergies would be a really common one that would come up. And whether they turn to Dr. Google or their GP, they're probably going to get the same answer, and it's probably going to end up with them on a very expensive prescription food and feeling like, okay, well, that's the life of the dog now, and that dog might be 2 years old, and now they're stuck. And during COVID, this was a big problem with people with prescription diets and shortages and not being able to fulfill those diets and people feeling absolutely hopeless, like, I don't know what to do because we don't learn about food and how that affects the dog, and so this holistic approach is really important. And maybe you can take us through how you created your approach, because I know you have a mnemonic where you kind of look at the entire animal and this whole dog and cat approach.
Sure. I want to capitalize on one thing you said, Drew, because it's a fabulous word, and that's hope. One of the things that happens when I see a second or third opinion case in my practice is that they have come and they're dejected. They feel that there is nothing else that's going to go on, that, this is the last ditch effort. And I can't tell you how many times between the wonderful technicians that I have and my interface with the client, how many times they leave going, I'm just so excited that there is a possibility. I don't sit there and promise them that I could cure their bone cancer, but at least we can make them a lot more comfortable. I don't tell them that I could always put out, could do it, take care of every problem there is, but giving those people the hope is really important. So when I came down to wanting to speak about this, I explained to you guys, I have a mnemonic called PETS, and it stands for proper nutrition and biome, exercise, training, and stress reduction. And in that mnemonic is the key to all of what I know that we can help our animals live longer, quality type lives. I'm not just trying to make your dog live to 15. I want it to be healthy through those 15 years. It doesn't do us any good if I make your dog live to 12 and it's miserable and it can't breathe and it's scratching its face off. You know what I'm saying? We have to do
quality of life.
Quality is very important, Mark.
Quality of life.
Absolutely.
Okay.
Very important.
Glad I could clear that up.
You did. Thank you.
You can always count on me.
Yeah.
And so let's go through your pet's mnemonic. I know you put proper nutrition there, and we were just talking about how a lot of times it's sort of a one-size-fits-all approach. If somebody comes in and says, my dog seems to not be tolerating his food or not be thriving on the food, where do you start with that as far as defining proper nutrition? Because, we had a great conversation on episode 2 with Linda Case, and really it was sort of looking at what is and isn't allowed, what some of out there is marketing versus actually, us understanding what is in these bags, and a lot of it being, the way that we're treating food, not just what's in there, but how it's being processed and what some of the outcomes are. And I know something I've heard you say before in conversations is also removing some of the toxic natures of chemicals and things like that we're exposed to, but also like through our food processing,
Sure.
what kinds of things we are doing to those nutrients. So can you kind of tell us a little bit about the P in pets?
Sure. So just to circle back for a second, if any of our listeners haven't listened to the Linda Case interview, you need to. It's a very, very important piece.
I agree.
Because we don't have any idea. Most of us have no idea what's happening in the food world. And it's, to many situations, it's abominable. Okay? Here's an amazing statistic. You'll love this one. We as humans eat 59% of our diet as processed food. Our pets eat, on average, 89% of their diet as processed food.
Gosh.
So when you take a dog kibble and you heat it to 400 degrees, and then you extra extrude it with heat extrusion besides, you now have double processed the diet, okay? So Linda really hit the nail on the head. When we talk about proper nutrition, there's a food hierarchy. I love talking about 2 books. The Forever Dog by Karen Becker, wonderful read. If people haven't read it, it's a great read. The other one is Ultimate Pet Health Nutrition by Gary Richter. These are both books that can really give the science, and also Linda's books. Linda's books are amazing. After I listened to that interview, I went out and got her books, and
That's awesome.
She's spot on. I mean, it's amazing. So there's a food hierarchy, and the food hierarchy is that whole fresh food is number 1. Okay. I remember a time living on the ranch and the farm when the animals ate what we ate. Okay. Now, there's a lot of people who could argue this point, but we didn't see the cancers. We didn't see the allergies. Maybe they didn't live as long. I don't know. There's a lot of things we could say about that, but I definitely feel like we've gotten so far away from that. We became a kibble society. It's easy. And if you, as a vet, the thing that was amazing as a vet student is they took us to a meat rendering plant, and we would watch them going through separating the foodstuffs. And, there would be the high quality steaks that are taken off of the cow, let's say, and the meats that we would eat. And then the pets got what was on the floor, or the offal, we call it offal, OFFAL, that's left over.
Yeah.
Some of that's tumors. Some of that's animals that have been injected with euthanasia solution. We don't know the half of it. And so what I tell people is fresh whole food is number 1, but it's a very difficult process. I can't, I don't know about you guys. I don't have the time to cook for my pets. I also, after 43 years, can't say that I could balance my dog's diet. Okay. It's very difficult. You have to worry about vitamin D levels and calcium. And, there are a lot of things involved. So the next step down for me, I like freeze-dried raw. And the reason I like freeze-dried raw is, I told Mark this earlier, dogs and cats have a 0 carb requirement. 0. And when they eat freeze-dried raw, which meaning people don't have to handle the raw food, they don't have to thaw out frozen raw, the water's been extracted from it, it's shelf stable, but basically they're getting protein and veggies, okay? Their protein requirement, dogs and cats, is way above what we're doing in a lot of situations. So, but then the next argument is, well, freeze-dried raw is very expensive for my German Shepherd, and I get it. It is. So the next step down for me is what we call complex carb dry foods. So these are the dry foods that basically are made from things like chickpeas or lentils or garbanzo beans. And I don't exclude the grains. We've talked about, there are some, in Chinese terms, we could talk about this a little bit later, but there are some cooling grains like oats, millet, and barley. So a lot of my diets are ancient grain, but it's also kibble. And so I try to get that to be affordable for my clients. When you talk about foods like Open Farm or Akana or Origin, these are better type foods that basically are not going to be highly heat processed. Like Open Farm, no GMO, no antibiotics or hormones. I mean, now we start looking at the really important things that we're getting out of that food that we don't want our dogs and cats to eat.
By the way,
yeah.
I'll just stop you for a second.
Sure.
We're not accustomed to mentioning brands here, but since you just did it, I'm going to go with it. I'm okay with it. Open Farm, for example, I think we talked about this when we met. That is a kibble, but it's not extruded.
It's not highly heat processed. So it's not heated to 400 degrees and then processed from that. And the base food a lot of times isn't a lot of the thing. If you're not doing GMO, you're not doing antibiotics and hormones, you're now really kind of limiting what the protein is going to be. And I don't work for any of these companies. Don't get me wrong. I don't represent anybody, but I like to give people always ask like, well, what are you talking about? Like just let me look in that direction. I'm not saying it has to be that, but what I'm saying is that freeze-dried raw many times is too expensive for our larger animals and it's not affordable. And fresh whole foods, as we talked about, is too difficult to do all the time. So we have to come up with something. And that's kind of the next step for me.
Well, that is a great place just to stop for 1 second, because Drew knows that when I founded Love Dog, and he and I have talked about how a lot of people, especially younger first-time dog owners and guardians, came up to me and said, Mark, just tell me how to feed my dog. And so we've had this conversation before. We had it a little bit with Linda, and you just said there's so much you don't know. So if someone like you doesn't know, how's the average person like me supposed to figure this out? And it is quite a maze to get yourself through. And I'm just wondering if it's a fair question could you tell that first-time pet parent, if I were you, here's how I'd feed my dog?
Yeah, I mean, what I'm talking about, and I do see, as I told you, a lot of second and third opinions, but I also see a lot of animals when they're puppies and kittens and how to start them. And the answer is I go over this explicitly with my owner in the fact that we talk about just what we mentioned, the food hierarchy, whether we can get into the freeze-dried raw world. If we can't, what kind of kibble we might feed. And in a typical, let's say, cat, I try to avoid all kibble because it's just not great for them. It really isn't. And I try to avoid canned food because you're paying for all this water. People don't realize that canned foods are 65% water. So why not buy the ingredients, which are freeze-dried raw, add your own water, and now you've got it. So a lot of times on my dogs, what I'm looking for, Mark, is if I can, a 30% freeze-dried raw, 70% kibble. If I can get better and I can do 15-50, I'm thrilled with that. On my cats, I try to get to give them a few munchies of kibble and do freeze-dried.
I think now would be a good time to break away for a moment and just mention to our listeners that there are a number of ways, important ways, that they can support us. If you're listening and you're enjoying the show and you're finding it helpful, here's what you can do. 1, you can spread the word. Word of mouth is the best way to get the message out there. And tell anybody you know, a friend, a family member who has a dog that you think might also enjoy it and find it helpful, just to take a listen. That would be amazing. You can follow us on your favorite podcast app. You can follow us on Instagram and TikTok. Our handle is @LoveDogNews. That's @LoveDogNews. And the most fun is you can buy us a cup of coffee. You can go to Ko-fi, which is KO-F like Frank I.com/lovedog and donate to the show, which is a great way to support us. And we set the minimum donation at $4, I believe, so it's not going to break the bank, as they say. All right, so we'll get back to the show now. Just wanted to remind you there are things you can do to help us along. So before we started, we were in this conversation about, I forget who you said it was, only feed your dog once a day. We're finding that dogs that are fed once a day are living longer. And I said to you, I could feed my dog 3 or 4 cups of kibble a day and call it a day. Or I could do what I do, which is to say, I give him a cup of kibble in the morning, a good quality kibble, and then I mix it up with a soft-boiled egg and half of a diced up apple. So he's getting calories, he's getting nutrition. The egg, I think, is great nutrition, but I'm mixing it up for him. And my point was that, and then at night he gets another cup of kibble, but I put in, fresh veggies that I steam up for him. And so I've had him now for 6 or 7 months. He's almost a 5-year-old dog that I adopted. He hasn't gained a pound. And as I was saying to you earlier, he's at the age now where he could easily begin to gain a lot of weight. This is when I would expect to see it. So I think by cutting back on the kibble and adding other whole unprocessed foods, I'm sparing him the weight
Absolutely.
gain. And he's happier eating twice a day versus once.
Well, what I mentioned was a group called the Dog Aging Project, which has looked at a lot of parameters in animals. And the take-home message from a lot of the food studies was that if we calorie restricted our animals, and many times that means, let's say, a once-a-day feeding, those animals lived on average 2.5 years longer. So that's a pretty impressive, that's not like 6 months, that's a pretty impressive time frame to be talking about this. And I think that it's important to, possibly look at some of this and just kind of see, what the research is telling us, what we know that we can figure out and how we can make that better. But I think that you're absolutely right, Mark. Fresh whole foods are great. And the whole idea is the only concern that I would have is to make sure there was something in there balanced, but you're doing the kibble. So that's going to be a balanced diet.
Well, and you're talking about convenience in both of these scenarios where it seems like it feels like, well, how did we get here? And a lot of that was based on how do we make it more affordable? How do we expand shelf lives for these dog foods? Because it was so hard for people, like you said, to feed a balanced, maybe biologically appropriate diet. And that's where dry extruded and kibbles really took popularity, was by giving people that at a price point where they could find it. And now that people are becoming more aware and they're sort of shopping with their values in mind, it feels like it doesn't have to be so either or, where you can say, okay, here's my base food. This is going to help us. This is doable, and then when I can add these things for nutrients, for longevity's sake, and
the interesting thing, Drew, is the companies are hearing this, and it's the largest growing section of food development, and food companies are all looking at it. They're looking at how do we get that better diet for these pets. We have to stop talking about natural food. It's really not natural. And Linda talked all about this. But the idea is they're getting it, and it's the largest segment in the pet food industry, which, as you guys know, is a multi-billion-dollar industry.
Right.
So before we move on to exercise, I just want you to mention, we don't have to take the deep dive right now.
Sure.
But, cooling foods like oats, millet, and barley versus hot foods like rice and quinoa. You mentioned, if a dog has inflammation, chicken, lamb, and venison might aggravate the inflammation, whereas beef is a cooling protein, a cooling food.
Sure.
Just for a minute.
Sure. So there's a principle called thermogenic property of food, and it's a Chinese medicine principle. They looked at foods in us for thousands and thousands of years, and there are charts. There's a huge, 300-page book all about doing this. But the idea basically is there are foods that create heat in your body. For example, in humans, ginger or habanero pepper is hot. Watermelon, cucumber, cold. So there are foods that create heat in your body. There are foods that are neutral, and there are foods that are cooling. And so what we talk about a lot is in conditions that are hot, the hot, itchy, red skin, the hot, painful leg from arthritis or back from arthritis, the cancers. Many of these diets need to be more neutral or cooling. And so the 3 meats we stay away from on the hot side are chicken, lamb, and venison. When you talk about grains, there are a lot of different grains, but the cooling grains that are really very beneficial can be oats, millet, and barley. And I actually tell people when I do a bland diet, everybody does bland diets when your dog develops diarrhea. I don't, right.
Chicken and rice.
I don't
chicken
do that.
And rice.
First of all, chicken's hot.
Yeah.
Rice is inflammatory. It's a simple carbohydrate. So I do ground turkey and oats. Buy Quaker oats. Just don't buy the quick, buy the regular Quaker oats. It's inexpensive, but it's a great bland diet. You know what I'm saying? So that's what you're asking about, Mark. It's called thermogenic property of food. And you can read more about it. There's an early text written for veterinarians and for owners called 4 Paws and 5 Directions. Cheryl Schwartz wrote it many years ago, and it talks all about these principles very, very simply for clients to read, for people to read about their pets.
And we will put all these references that you're talking about in our show notes, not to worry. Yeah, not to worry. Do you want to move into exercise? The E?
I'd actually like to spend 1 minute on biome, because that's the other part of the P. So biome, which is the look at all of the good and bad beneficial bacteria, yeast, fungi that are in your bowel, all of the gazillion microbes that are in there. We've now learned how important this is. And we have now learned how that affects so many different things in the body. If you watch TV these days, which I try not to do too much, but they're even talking about vitamins for people that address the biome. And people go, I don't know what biome is. Biome is a look at what's in your bowel. 70% of your immune system is in your gut.
Wow.
Okay?
Say that again.
70% of your immune system is in your GI tract. And as Drew knows, we talked about this and he was wowing me on this one. The gut-brain connection is huge. The University of Arizona is doing a study in humans here on biome and neurology, nervous system disease. They're looking at seizures and mania and bipolar disease. And just to give you an example, like there's one child that came in there whose biome was so messed up when they looked at it. We can measure this and we can talk about how we do that. And when they addressed this child's biome, now she was seizuring on average 1 to 2 times a day. A young kid seizuring that often.
Gosh.
Couldn't control it on medication. You know what they did? They corrected her biome. She's down to once a month.
Wow.
Okay? And that's just one little episode. And I could tell you all kinds of stories about biome, but Margot Roman in veterinary medicine came up with fecal microbiome transfer, the giving of good poop to our animals. It sounds disgusting, but it works amazingly well. There's a company that I use called Animal Biome, and they look at poop samples for dogs and cats and give us a 10-page report and say, okay, that animal's biome is imbalanced. It's missing these common bacteria. Here are the harmful bacteria it has, and here's what we do to correct it. Do we need to have more fiber? Do we need to add more protein? And then are there specific supplements like Gut Restore, which is a fecal microbiome transfer in a capsule that we can give our dogs and cats? Or do we have to give it by enema? There's ways that we can do this, but correcting that biome, and we'll talk about that because the case that we're going to talk about has a lot of that in there. It's incredibly important, incredibly important.
Interesting.
So just to mention, the 2 things that I do every time I have a second and third opinion, especially if it's in the world of allergy, GI disease, even cancer, and also behavioral, is I get what's called a NutriScan test, which is a food sensitivity test done by a woman by the name of Jean Dodds, who's just amazing veterinarian in California. It's not a food allergy test, it's a food sensitivity test. And I also do animal biome testing. And between those 2 pieces of science, I now have a way to look at this animal and say, how do we balance this animal to help with the skin disease, the arthritis, the behavioral problem? And that's amazing. So that's why I wanted to take a second to talk about biome, because that's part of that P.
So a question that I have is, a dog comes to see you, second, third opinion,
Right.
and the dog is 5,
Right.
versus a dog comes to see you and the dog is 13. You can do a lot more for the dog that's 5 and give that dog a much better, brighter future.
No.
Correct? What can you do? What can you do for the
Same
senior
thing.
dog?
You're wrong.
I'm wrong.
And the reason why you're wrong is I may only have 2 or 3 years, Mark. Not really wrong. Not really wrong. But I may only have 2.
I'm wrong.
You may only have 2 or 3 more years with that 12-year-old. But why shouldn't they be quality years? Okay? I can do the same thing for both animals. Yes, The 5-year-old animal, we're going to affect a lot more of its life, obviously, because there's a lot more to come. The 12 or 13-year-old animal, not so much. But, I have a lot of dogs that, people come in, well, he's 12 years old, so, it's not going to be too much longer. And the first thing I say to them is, and I remember this for myself, age is not a disease. Okay? Yes.
Thank you.
So
yeah.
that 13-year-old dog, balanced on the right diet, on the right supplements, could be an amazingly, I've had people, just had one guy yesterday, Friday, who's a very dear client of mine, has 6 dogs. His older dog basically he came to me and said, this is a quality of life conversation. This dog is 13 years old. It has severe arthritis. It has this problem and that problem. And I don't really expect very much. And I go, I'll tell you what, let's go back. Let's decide that we're going to try to do what we can for Zoe and see what we can do. He came in, was a recheck. It was 8 months later. He looked at me and goes, this dog is jumping off the sofa. It's running after my 5 other dogs. I just never would have believed that. And so even if Zoe has another year or two, at least she's doing that where she could hardly get up when I saw her.
Well, this is that pathology piece, Randy, where you were saying dogs are only living 2/3 of their life. We have a cultural expectation that, you're past year 8 and you're at this weight, so your dog is in their last few years, versus saying, what can we do to create health and how does that go? You mentioned the dental earlier. Years ago, I had a border collie who had fractured a tooth way in the back and I couldn't even see it. And until we got in there and figured out, we needed to actually do an extraction, I swear she got like 2 years younger.
Of course.
I thought she was on the downward spiral. And as soon as that inflammation and problem that I had no idea was taken care of, she came back to a picture of health, and we got more and more years out of that dog, and she had a great quality of life.
And I love that you relay that, Drew, because that's absolutely the truth. The situation is 40 to 50% of dog and cat disease is periodontal, meaning under the gum line. And until you take x-rays of that mouth, which we do every time we do a dental procedure here at PAWS, you're not going to find some of those things. And you can imagine, if anybody's ever had a root issue where you have to potentially have a root canal, let's say, God forbid, or do something else, you don't realize how much pain you're in. And then also how stress that is to the body, circulating all of those bad bacteria and also those pain receptors in the rest of your body. So Drew, that's a fabulous example.
Well, and it kind of takes us to the exercise piece. We just had Dr. Maria Bartling on, and we were talking a lot about pain and how often I'll go to see somebody for behavior, which is another part of this puzzle. And I'll say, I don't want to start you on a behavior program until you've been assessed for pain or until the animal's been treated for an obvious observation that we've made during the gathering of that history. This whole model of a tired dog is a well-behaved dog. Yes, there's something to be said about good quality exercise, which I'm sure you're going to get into, but this whole idea of exhausting a dog to the point of not performing behavior is such a bad model for
I absolutely agree. No, we're really big. We have the ability in Arizona because a lot of our dogs can swim. And, what a wonderful exercise. Our rehabilitation is underwater treadmill, part of it, where we take 80% of the weight off of a dog's body while they can move in their proper way and whatnot. But great walks. I use something called a walkie dog. And again, I know Mark doesn't like me mentioning products, but it's amazing. It clips onto my mountain bike and my dogs can go for a run with me on a very conservative pace, but I can get a mile or two in with them in a very short period of time. There's ways of doing this. And I know you know this, Drew, but like things like scent work and other type dogs love jobs, and cats are the same. Let's not forget about, I know this is a love dog podcast, but we
love cats.
A lot of our dog people have cats, and cats love laser pointers to chase and bottle caps and catnip toys, and they like that stimulation. So very important piece in the mnemonic E for exercise. Yeah.
So the point being, it's good for their bones, it's good for their muscles, it's good for their behavior, and it keeps their weight down. It's just like for humans. It's the same kind
exactly
of thing.
the same, Mark.
I did ask Marie when we interviewed Dr. Bartling. I did ask her, "Is there a point where you can over-exercise the dog?"
Absolutely.
And she liked the question, and the answer, of course, is yes. And so I think people have to be aware, not to overdo it. And the dog may send signals, "Not today. I need to recover."
Absolutely.
Well, and this is something, Mark, you hit the nail on the head. I mean, there's a guy, just anecdotally in my neighborhood, who I see every morning, and he's got a couple field quality looking labs, and he goes out and he plays fetch with them every morning. I see him out there, and the dogs, it's almost just a compulsory game where he's throwing 3 bumpers and they're all going out. And I can see one of the dogs can barely walk, and sometimes when we do these repetitive games and these exercises, or something that has a lot of high impact, like jumping off of something down, these things we're doing for the sake of a benefit to the animal can start to wear things out, especially if we don't mix that up or be conscious of it. You mentioned laser pointers, Randy. I don't love those for dogs. My replacement's called a flirt pole. It's basically a big cat toy for dogs, because they actually get to catch it. But I have to be careful myself. If I see something that's asymmetrical, as Dr. Bartling taught me, when I'm playing with the dog, I don't want them making those hard cutting motions and thing unless they've been fully assessed. So,
and that's a really good point, Drew. I mean, the thing I didn't mention is, if you're going to embark on a new program with your dog, have your veterinarian take a look and make sure that there aren't any problem areas that you want to avoid, some things that you don't want to do. You certainly don't want a long back dog that's had some issues with their back to be jumping off of the sofa or jumping out of the pickup truck. So it's very important to have that assessment. Whether it's Western or integrative, Mark, it doesn't matter, but have the animal assessed first, because you want to make sure that there really aren't any hot spots to be concerned about.
Well, and you brought up, your T is training, and I know that involves socialization, but I really like thinking ahead. When I see these big, giant breeds or some of the long back dogs, like you said, I want to start teaching that dog to be comfortable, maybe from a fun agility standpoint, running up ramps and things like that now, so that when we get to 9, 10 years old and people are telling me you can't teach an old dog new trick, and I'm like, yes, you can. It's just going to take a little more work. Why not teach them when they're young to follow a lure, or, to do some hand shaping techniques for brain games? And then you have this really useful tool for putting your 120-pound Newfoundland in the back of your SUV when, that aging and that joint deterioration does eventually come. And
that T for training, I mean, as you know, Drew, training really increases the pleasure center of the brain for our animals. They release less of cortisol levels, the stress hormone. They release more oxytocin, which is the pleasure hormone. And, it's just repeating positive behaviors and basically getting the confidence level of our dogs up. I mean, this is what Drew does all the time. I'm not telling him anything new, but I wish we had more Drews, especially I wish I had Drew in Tucson, because it's hard, because some of the training that we see here is inappropriate. And it makes it very difficult. But very important, training and socialization, a very important piece in my world. The biggest thing that I wrestle with, and maybe Drew, you want to talk about this, is I've got the young puppy who I'm worried about vaccination status. And yet I know that it's so critical by 14 weeks of age that dog have socialization. And so sometimes it's hard to balance that situation, I find.
Yeah, it's, the American Veterinary Society came out and did their position statement encouraging people to put socializing higher than that risk of potential disease. But some of that has to be a little bit of environment. Like if you're, and, it's kind of a privilege response, to be honest. If you're in a very affluent area where vaccination rates are high and things like that, you're at a lower risk for transmissional disease versus, if you're in a part of town where you don't think a lot of those animals are being vaccinated and things like that, it's certainly a higher risk. But also, the place you go to talk about well-being might be somewhere where you might encounter some of those things, like the veterinarian, for instance. So you might have to pick and choose. Also, socializing doesn't have to be flooding. I think we have this misconception that to give the animal experiences, we have to throw them in the deep end. You can certainly sit which I do a lot in the back of a car and watch people come in and out of Home Depots, watching dogs from afar at the park without going into, say, a crazy dog park environment, which would be high risk for mental and physical and disease issues for a puppy.
Sure.
So there's lots of ways to do it where you don't have to quite go in the deep end to get those good early experiences.
Great.
And some of the fallout of COVID was these dogs didn't get those early experiences. And now what we're seeing with a lot of the dogs who were young dogs during that period of time is that lack of socialization, that lack of experiences. So even just new things happening in their environment, there's a lot of things you can do if you're isolated in your home or if you're in one of those high-risk areas, just to change up your environment so the dog is having new mental stimulation throughout the day.
Yeah, and the interesting thing, Mark and Drew, is that as a veterinarian, we're seeing the most aggressive animals we've ever seen in the veterinary practices, and many of them are COVID animals. And just for the things that Drew elucidated, the lack of socialization, the lack of time with other people, the lack of time with other animals, it's really sad. I mean, I have to tell you that on a daily basis, we see animals that we could hardly even look at because they're so aggressive. And many of them date from the COVID time.
Well, that kind of brings you to your S of your pets, which is stress reduction. And I think training for veterinary and grooming handling is a great thing to incorporate into daily activities. And maybe we'll do a whole show on it, but there's some brilliant stuff out there with Chirag Patel's bucket game and some of the work that the fear-free folks do of just teaching animals how to participate in that veterinary experience. But what are some of your stress reduction that falls into that wellness model?
The stress reduction for me has a lot to do with eliminating toxins and stresses on the body and things like heavy metals and mold. And, we talked about the high processed foods. So we're talking about something called advanced glycation end products that come from high heating these foods. There's also something called Maillard reaction products. Both have been known to be cancer productions. And, I don't know if I mentioned, but, the cancer rates in our animals are so high. 1 in 5 dogs at the age of 10, 1 in 4 cats. Cancer has really become, a huge problem, as we all know, and it's not getting much better. The average golden retriever lived 12 to 14 years. Now their average life expectancy is 7, and most of it is cancer-based. So things like, glyphosate. Here's another one that just drives me wild. I ride my bike. I do a lot of bike riding here in Tucson, and all I do is see the county spraying with Roundup, and glyphosate levels in dogs' livers at the vet schools is 30 times what it should be. Jeez. You can't tell me that that's not creating problems for our pets. Just when we were talking about the things that, basically shorten their lives, there's a huge one right there. And so if you're going to use, please don't use, Roundup around your house. And because pets go out and walk, they lick their feet. They go out on the golf course, they lick their feet. And now they have huge doses of these toxic products. Toys and bedding. I mean, there's phthalates, there's formaldehyde in carpeting and rugs. There's topical insecticides that people will use. Air fresheners and PFAS in the house. Again, things that we can take care of. Here in Tucson, we talk about water. I mean, it's getting to be a rarity, and it's not going to get much better, unfortunately, in the Southwest. But our water is so hard and so high in calcium that if our clients aren't filtering their water, specifically with an RO system or something like that, then these pets are getting huge doses of hard, high calcium water, which doesn't help. I mean, certainly leads to stones in you and I, and certainly I'm sure leads to bladder stones and kidney stones in dogs and cats. And then even things like excessive noises in the house, things that the animal, I talked to a lady who has her 2 dogs in the garage, and at night she turns the fluorescent lights on because she doesn't want them to be scared or whatever. So these dogs are trying to sleep in a photo period that basically has been totally messed up. It's light 24 hours a day for these dogs. That's not healthy. Yeah. So those are the kind of stress reductions I look at, quite honestly.
Well, and some of these little lights and things that you're talking about emit sounds that might not be audible for us, but a lot of the animals are picking up on those frequencies. And I think there's some environmental things like that we could all think about for our own health too. We were talking to Kim Brophy, who we're going to have on the show, and she was likening dogs to being the canaries in the coal mine, where we can see some of these health things happening in our pets. And really, we need to turn that mirror around and go, gosh, this is affecting us too. What can we do to create wellness for all of us?
Sure.
That's great. Thank you for taking us through your PETS acronym. That's really helpful.
Absolutely.
Hey there. Just one last quick little break before we wrap up our conversation today. I just want to remind you that this episode was brought to you by Jope's Hip and Joint Dog Chews. They chose UC2 for its superior efficacy compared to glucosamine. They added higher dose EPA and DHA omega-3 than leading brands and included 95% concentrated curcumin from turmeric. Jope's Hip and Joint Dog Chews have been a game changer for my own dog, and I recommend them to all of my clients. Go to petjope.com, petjope.com, and enter promo code LOVEDOG at checkout to get 15% off your first order. Also, Colorado Citizens for Canine Welfare. Attention dog lovers, we've got a real problem. Every day, thousands of dogs are being bred in this country to produce for-profit puppies. These dogs are kept in deplorable conditions and routinely bred to turn out litters of puppies to be bought and sold in pet stores across the country. This has to end. Together, we can stand up to these cruel practices and say enough. We have teamed up with Colorado Citizens for Canine Welfare to educate, advocate, and stand up for dogs everywhere who desperately need our help. To learn how to find licensed and inspected shelters and rescues, go to the Find Dogs page at caninewelfare.org today. Now, let's wrap things up with Dr. Randy Aronson.
So to end part one, I would love you to just talk about a case study which shows us the outcome.
Sure, absolutely. Because I know your Mark is outcome based, so we're gonna give him outcome.
I'm
so
very
let me talk.
outcome based.
I love it. I think it's great.
Yeah,
Listen, the proof is in the pudding, right?
Yes, sir.
Yeah. So Lulu, an 11-year-old female spayed bull terrier, comes to see me. Has a history of recurrent interdigital pododermatitis. Let me explain that. That's cysts and infections in between the toes. Okay? Interdigital pododermatitis, podofoot dermatitis, skin disease. Severe pruritus, so severe itching all the time. Alopecia, hair loss. Okay? Also has valley fever, which in Arizona is a fungal disease called coccidiomycosis. Where you guys are from, they have blasto and histomycosis. There are other fungal diseases, but valley fever or coccidiomycosis in the Southwest is a terrible problem. The fungus lives in the desert. The dogs and cats inhale it, and it's a problem. So the dog has been, this is now an 11-year-old dog, Mark. I love this because this fits into your question about the 13-year-old animal. So this dog has been on 3 different prescription diets. I'm going to tell you, I hate prescription diets, okay? The companies that make this don't like me saying this, and I'm not going to mention any, but I hate them. Because if you look at the ingredient list, first ingredient's corn. Second ingredient, chicken byproduct meal. That means the USDA says that could be beaks and feathers, okay? That's not a protein source for our pets. So anyway, it's been on 2 different prescription diets.
And I just want to say to your point about Roundup earlier.
Yes.
If the first ingredient in these diets is corn, it's probably GMO corn. It's been sprayed with Roundup.
Thank you.
You're welcome.
Good point, Mark. Thank you. That's a really good point. So the dog had also been on 2 immunosuppressive type drugs, Apoquel and Atopica. These are drugs that decrease the immune system so that the histamine or the itching and scratching will decrease and the allergy symptoms will decrease. 3 or 4 courses of antibiotics. And, occasionally the dog had some partial help. It got better, but then it recurred right away and came back. And so the lady heard about what I was doing through somebody and came to see us for a 1-hour consultation. And what we did was we said, you know what? We're not going to live up to the definition of insanity with your dog. We are not going to do the same thing and expect different results. We are going to talk about how to do this differently. And this is where we speak to Mark's foundational medicine. Okay. So the first thing that we did was we talked about food, and we had the food conversation that you and I and Drew have had today. The second thing we did was we talked about some supplements, and I'll explain some of those in a second. I sent home a handout for her to start with something called Ion Gut Health for Pets, which is humic and fulvic acid to work on closing what we call the tight junctions in the dog's bowel. This is aimed at what we call leaky gut syndrome. And I have great results with that. I also had them get colostrum. I also had them start something called Canine Belly Bliss, which is just some supplements for bowel maintenance.
Did you say colostrum,
yes.
like mother's milk?
Yes. But usually I have them get it in capsule form. Many times I just have them get it on Amazon. And it works very, very well because I want to get those initial antibodies back into this dog. At that time, we ran regular lab work. All the regular Western lab work, totally normal, okay? We also ran a NutriScan test, which is what we talked about, the food sensitivity test. That dog came back sensitive to soy, quinoa, turkey, and salmon. And this lady wanted to do a vegetarian diet for its dog, which is another whole subject. But the soy-based diet would not have been a good choice for this dog. Sure. And then we got back the animal biome test, which basically told us the dog had severe biome imbalance, missing common bacteria, a lot of harmful bacteria in the way of Clostridium perfringens, or C. perf, it's called. And so now we had some science behind some things that we could start to do to balance this dog. We gave it something called Cytopoint, which is an injection. It's a monoclonal antibody just to turn off the histamine for a short period of time. Okay? It's not an immunosuppressive drug like Apoquel or Atopica. I did recommend a product called another antihistamine over-the-counter product called D-Hist, which I use a lot myself. It's a natural product. And then what we ended up doing was putting the dog on a cooling diet, freeze-dried cooling diet. We use a company called Side by Side, but it doesn't matter. And we did use Open Farm Ancient Grain, again, balanced with what the food sensitivity test told us. So there was none of that in there. And put it on omega-3 fatty acids, something called Dermaquin, used Animal Biome's balancing gut restore capsules and their beneficial yeast called Espellardi, which now you'll find, I now see there's 3 or 4 companies coming out with an Espellardi product. Interesting. And that dog went from...
What is that Espellardi?
So it's a beneficial yeast, Drew. It's a yeast that helps balance the bowel, and it actually acts as a really wonderful pre and probiotic. And it has FOS in there, which is fructooligosaccharides, which are basically fiber. So that fiber helps feed the beneficial bacteria also. And that was what came back on the Animal Biome report that we knew to do from testing this dog. And remember, all of its regular lab work was absolutely normal. Right. We changed the diet very slowly, a quarter of the new diet to 3/4 of the prescription diet for 5 to 7 days, and then half and half, and then 3/4, 1/4. 6 months later, that lady came in, no Cytopoint injections. The dog had no interdigital cysts in that period of time. Its coat looked absolutely amazing. All the hair regrew. It wasn't itching and scratching. And it's gone out now 2 years with just maintenance products anymore, doing fabulously. So There's a case where if we did the usual Western medicine, which has already been done, and really only had temporary relief and flared up, only to flare up again, we now have this dog on a foundational integrative program where, and when it's due for vaccinations, it gets titers and not the distemper parvo vaccine. It's another whole conversation. But this dog is doing amazingly well. And this lady thinks I walk on water. And I told her the only reason why I can do that is I know where the stones are, So, yeah. Do you know what I'm saying?
Mm-hmm. This was a good example of the foundational path.
Right.
You started with the foundation and you worked your way up.
And remember, Mark, this dog was not well at 2 weeks after me seeing it. Okay. It was still having a lot of issues.
You said that was like a 6-month reset, right?
Absolutely. And that's the hard part because two things are interesting. In integrative medicine or in Chinese medicine, a lot of time we talk about these toxins have to come out of the body. And many times they'll get worse before they get better. And that's a hard thing to swallow. You know, you got your dog itching and scratching and tearing itself, and now it's doing it more. First thing you think of is like, what's that quack doing? This isn't getting any better.
Yeah.
But if you can hang in there, and this was an individual approach, that's how we approach each one of these cases. It's not a one size fits all.
Right. I hear a deconstruction going on,
Right.
is what I hear.
Yeah.
Which is when the dog starts to itch more and the client is freaking out and saying, you're a whack job, what are you doing? You're actually deconstructing and getting it back to a baseline, to an index of 100. And then you begin to rebuild. And as you rebuild, you're essentially, the way I hear it is, you're rebuilding and you're reconstructing the dog's systems.
Correct.
To start, I don't know if that's quite right, but so that they can begin to function properly. You're balancing things out. You're creating a new kind of homeostasis. I know that word.
Absolutely.
Inside the dog, and then these symptoms start to go away because the insides of the dogs are working the way they're supposed to work.
Right, because we're dealing with, like we talked about, we're dealing with the foundation. We're going back to square one with this dog. And, it's like peeling the onion. Many times you have to get the layers until you get to the core. And once you can get to the core, you can get, this wellness and longevity to go, quality especially. And so that's a great example. That case is a great example of how that works.
Dr. Aronson, give our listeners some language if they wanted to talk to their veterinarian, their practitioner about maybe doing some testing. I know you've mentioned Gene Dodd's NutriScan and the Animal Biome. How could our pet parents talk to their veterinarians about these if that's something that's interested, so that they don't just come in with their Dr. Google, well, I heard on Love Dog you should be doing this test. What's a good way for them to bring this up if they're curious? I know a lot of people suffer with allergies and they just immediately get put on the hydrolyzed
protein.
That one for me. Hydrolyzed protein diets, and it might actually help them for a period of time. Then they're looking at the bill and they're looking at the longevity and asking, like, is this sustainable? So how would you advise them to have those conversations?
Well, the first thing I'll say is be diplomatic. Because, coming to me, I've always been open to what if. I have clients coming in suggesting these outrageous things, coming in with bags of supplements and going, what do you think about this? And I have to look through each one of them. But I think, if their animal isn't getting well, I think the thought is can we look at this a different way? Are there some possibilities that we might look at, let's say, a food sensitivity test? Or is there a possibility we might look at the dog's biome? There are going to be some veterinarians like in MDs that are just going to be like, forget that. I'm not, I don't care about that. I don't know anything about it. I'm not going to do anything about that. And my suggestion is maybe find somebody different, find somebody who's open. Because, I don't know homeopathy, but I'm certainly open. If you can come to me and say, I would like to do some homeopathy for my dog, I'm going to get you to somebody who can do that. It's anytime you think you're an expert in this world, in veterinary medicine especially, you're fooling yourself, okay? I learn every single day. And that's the ticket. You have to be open. So, it's a funny conversation and it's a difficult conversation, Drew, because I used to have the radio station people do that, where, I heard about methylcobalamin for my dog's nervous system disease. And then they'll go to their veterinarian and they'll go, well, I don't know anything about that and I can't tell you what to do. And so it gets dropped,
And I think when you're really looking at a picture of health, it's good to have multiple viewpoints. We tend to take our puppies to a veterinarian that's conveniently located near us, and then that's their doctor for the course of their life, versus it might be worth taking time or driving a little bit further or doing some research to find somebody who really meets your personal needs and answers those questions if you're not finding that that connectivity with your provider too.
There's a list, AHVMA, the American Holistic Veterinary Medical Association, does have a list of veterinarians all over the country that look at some of these things that we talked about. And it may be very worthwhile if you're in an area that has somebody to even seek that person out just to get an idea.
Okay, I think that's a great place to stop on part 1. And when we come back in a couple of weeks, we're going to pick it up and we're going to talk about what we can do to prevent disease and keep the dog healthy. And we're also going to talk about some of the more common illnesses like arthritis, cancer, GI tract illnesses, and allergies. That'll be in part 2. Thank you so much. This was incredible. I learned a lot, and we're going to see you again in a couple of weeks.
My pleasure. Thanks, guys. I appreciate you doing this.
Thank you.
Take care.
Hey, so that wraps up our show for today. That was part 1 with Dr. Randy Aronson, and we will get to part 2 in about 2 weeks. Hope you enjoyed that. I sure got a lot out of that. He's an amazing man with an incredible amount of experience, more than I'd say most out there. So we were lucky to get Randy on the show. If you liked it as much as I did, there are so many different ways you can support us. Very quickly, you can follow us on your favorite podcast app. You can spread the word, tell a friend. Word of mouth is always the best way. If you've got a friend or a family member, let them know about us. You can follow us on Instagram. Our handle is @LoveDogNews. And I think Drew's going to be starting a training tips series on Tuesdays. That should be a lot of fun. Hopefully we'll get that going next Tuesday. It'll be a weekly thing and you'll learn a lot from Drew. He's incredible. You can buy us a cup of coffee on Ko-fi, Ko-F, like Frank I, /LoveDog. Minimum donation, $4. We can use all the support and all the love and all the donations you guys are willing to give. Thank you for that. Ko-fi /LoveDog. And we're doing our first live event in Denver on June 2nd. It's a Sunday morning from 10 to noon. We've got some great panelists lined up, some great sponsors. It should be a lot of fun. And it'll be a future podcast for the show. It's our first time doing it in front of a live audience. Head over to the show notes and you'll find a link to Eventbrite where you can buy tickets. Okay, so thank you for listening. We appreciate you so much, and we'll see you back here in 2 weeks for part 2 with Randy Aronson. So long.
Good point, Mark.